Pathophysiology is one of the toughest subjects for nursing and medical students. Why? Because it's often taught as a giant list of facts to memorize instead of a story to understand. But what if I told you there's a much smarter, more logical way to learn it? In this video, we're going to break down how to approach pathophysiology so that you not only understand it better, but remember it for the long term. So, what is pathophysiology, really? It's simply the story of what happens when the body's normal functions go off track. The absolute key, the non-negotiable first step, is to master normal physiology. I see so many students jump straight into the disease without fully grasping how the system is supposed to work in the first place. When you skip the normal, the abnormal feels random, confusing, and impossible to remember. It's like trying to fix a car engine without knowing what each part does. A powerful way to structure your learning is a simple three-step method for every system you study. First, understand the normal function. Second, identify the trigger of change, like an injury or an infection. And third, trace the consequences that result from that trigger. For example, instead of just memorizing the symptoms of heart failure, you should focus on the cause and effect chain. How does a weakened heart muscle, the trigger, lead to fluid backup in the lungs, the consequence? This approach turns memorization into logical deduction. It's especially vital for nursing students because it builds the foundation for strong clinical reasoning, helping you understand the why behind your patient's symptoms. Another game changer is visual learning. Our brains are wired for images. Pathophysiology is full of complex processes that are much easier to grasp with diagrams, flowcharts, and concept maps. A good flowchart can show the entire cascade of events from a cellular change to a systemic problem far more effectively than 10 pages of dense text. It helps you see the connections between structure and function, making the information stick. Don't just read about it, draw it out, create your own maps to connect the dots. A very common mistake is studying diseases in isolation, as if they exist in a vacuum. But the human body is an incredibly interconnected system. A problem in the kidneys can affect blood pressure, which impacts the heart and brain. When you study, always ask yourself, how does this condition affect other body systems? Thinking this way doesn't just prepare you for exams, where multi-system questions are common. It trains you to think like a seasoned healthcare professional who sees the whole patient, not just a single diagnosis. After you've studied a topic, it's time for active recall. Don't just reread your notes, that's one of the least effective ways to learn. Instead, close your book and try to explain the entire mechanism out loud, in your own words. You can do this to a friend, a study partner, or even just to your reflection in the mirror. If you get stuck, that's where you need to go back and review. This process of retrieving information from your memory is what builds strong, lasting neural pathways. Finally, don't be afraid of the science. Many of the explanations in your textbooks come from evidence-based research. Developing some basic research literacy, learning how to interpret scientific language, and understand where this knowledge comes from will deepen your comprehension immensely. It adds another layer of meaning to what you're learning. So, let's recap. Pathophysiology isn't about memorizing endless lists of facts. It's about building a mental model of the body's response to challenges. It's about understanding the story of cause and effect. When you approach it this way, starting with normal physiology, using visuals, connecting the systems, and practicing active recall, it becomes clearer, more logical, and a lot less intimidating. You'll transform a subject that once felt overwhelming into a fascinating puzzle that you actually enjoy solving. If you want to keep learning medical concepts with clarity and build your professional reasoning skills, make sure to subscribe to Unlimited Hub, and don't forget to check out our playlist on medical education, simplified for all healthcare learners. Thanks for watching, and I'll see you in the next video.